Have you ever had malaria before? Malaria is a hemoparasitic disease. Have you ever had malaria before? And have you noticed that when you have malaria, you have joint pains? Have you ever noticed that? So I'm going to explain why when you have malaria, part of the symptoms you present with is joint pain. Welcome back to my channel. If this is your first time on my page, thanks for stopping by, and if you're a returning subscriber, thank you for the care and the support. Okay, so today, as I said, I'm going to be talking about malaria, and about malaria's specific symptom, joint pains. So what is malaria? You can drop your comments and tell me what malaria is and if you've ever had the disease malaria. Malaria is a hemoparasitic disease, in short. Yes, when I say hemoparasitic disease, it means it's a parasite that affects the red blood cells, and it is caused by a pathogen known as Plasmodium. And this Plasmodium has a lot of species. There are about 6 of them. I'm going to be listing them. There's Plasmodium vivax, Plasmodium ovale, Plasmodium knowlesi, Plasmodium malariae. Yes, there are about 5 of them. Yeah, so and this malaria presents with different symptoms. It's a systematic disease because it affects various systems. It affects the nervous system, the cardiovascular system, the musculoskeletal system. It affects a lot of systems, and some of these symptoms which you can experience: you have headache, you have nausea, you have vomiting, you have abdominal pain, you have joint pains as well. So you are seeing it affects a lot of systems, and specifically the symptom that I want to talk about today is joint pains. Why do we have malaria and have joint pains? It's a very simple pathophysiology, but you understand it today. What happens is, as I said, malaria is a hemoparasitic disease, means it affects red blood cells. So when it finally enters the blood vessel and attacks the red blood cells, in simple terms, it causes the red blood cells to become sticky. When all these red blood cells coagulate and come together, it occludes the blood vessel. Yeah, so it's like I've taken my arm, for example, and I've put it in between the blood vessel. So when I occlude this blood vessel, what happens? There's decreased blood supply to various areas, and part of these areas that are being affected, you have the joints. And when there's decreased blood supply to the joint, it causes what? Hypoxia. And anywhere that there's hypoxia, there's pain. That's just it. That's just the pathophysiology. So it causes the red blood cells to be sticky. They become sticky. The red blood cells join together. They block the blood vessel and decrease blood supply to the joints. And when they decrease blood supply to the joints, it causes what? Joint pain. It causes what? Pain. Because anywhere I said there's hypoxia, there's pain. So that's just the reason why anytime patients present with malaria, they usually also present with joint pain. I hope this video was helpful. I hope you learned something. I hope I was very, I know put a lot of medical terms into it so I can also understand. Please help me promote my channel by sharing my content, putting it out there, commenting, and again, tell me what you want me to teach you about. Tell me what you want to know about, and I'm going to be here for you and break it down to the simplest terms. Thank you. See you in my next video.
First time on my channel, please hit the red subscribe button below and turn on the notification bell so as not to miss anything. Thank you.